In response to the health and rights needs identified by the 2015 Demographic Health Survey, World Vision Tanzania implemented the SUSTAIN-Kigoma project, which is funded by Global Affairs Canada in support of reproductive, maternal, newborn child and adolescent health, RMNCAH, in the 6 districts of Kigoma region. This project has managed to reach direct beneficiaries 396,434,134,656 women, 89,645 men, 39,903 adolescent girls, 32,348 adolescent boys, 22,323 newborns, 224 CHWs, without forgetting 239 health services managers, and 736 religious leaders. These women and men, adolescent girls and boys, were reached through a vast number of activities that were carried out by the SUSTAIN project in the 6 districts of Kigoma region. The project team, jointly with government's experts, held series of trainings to clinical officers, health committees, CHWs, CVAs, VSL, and adolescents in promoting good health practices, reproductive, maternal, newborn, child, and adolescent health care. They played vital roles in influencing behaviors of health actors towards quality services and community engagement, built on a foundation of promoting gender equality in communities to help ensure safety to newborns, children, adolescents, pregnant women, and mothers. Using the men care model, the SUSTAIN project worked with Baba Bora male leaders who are trained to train other men in their villages to willingly support their pregnant wives and mothers to fetch water, wash dishes, clean the house, and accompany them to clinics. A total of 140 Baba Boras were identified in all 6 districts. One of the Baba Boras is Eric Kimari, a father of 4 children from Bitale village. Upon receiving a training at a coffee kiosk, he was inspired to support his wife with washing dishes and cleaning their house. This was not normal then, as Kigoma previously valued older and often patriarchal traditions, where men did not typically support their wives with household work. As a result, they were sometimes stereotyped as being controlled by their wives. But community attitudes gradually shifted when they saw the impacts. This is all in the past now. They are really Baba Boras.
Sasa walivyonichukulia vibaya. Siwajua hicho kitu wengi ni kigeni. Kwa hiyo walinichukulia tofauti, wakasijua mama amenipa nini, limbwata tayari mke wangu amenipa dawa ya mapenzi ya kupendwa niwe kama kondoo. Kwa hiyo ndio maana nafanya zile kazi, kawaambia hapana, wala mimi sijaishwa chochote. Ila tu nimeelimishwa na yakaniingiza kichwani, ndio nikafanya hivyo. Unaona, na watu walisema mengi, hata wanawake baadhi waliongea mengi, walicheka kwamba mimi bushoke nini, nimekuwa bushoke, lakini kumbe wanacheka kitu ambacho sio kifahamu. Walisema mengi.
CVAs and CHWs reached out to adolescent and young women to guide them on their safety and of the newborns by directing them to clinics. SUSTAIN projects have established 65 peer education, adolescent sexual reproductive health clubs in secondary schools in all 6 districts. These platforms seem to promote taboo practices. This was how Sabina and her parents used to think about peer clubs. And this is before they experienced sensitization assessment, realizing they were learning to be better parents for the future.
Hii elimu ilipokuja, kwanza sikuipokea vizuri kwa mara ya kwanza. Yaani niliona kama vile mambo yanayofundishwa si kwa lengo la kumjenga kijana sasa. Nikaona kama vile wanataka kupotosha. Lakini nilipokaa nikafikiria, lakini ni baada ya kuangalia kile kitini. Maana mimi sikutaka kukataa moja kwa moja pasipo kufuatilia. Nilikuwa nafuatilia, nikachukua vile vitini, nikawa nasoma. Nikaona yana mambo mazuri sana. Nikasema hii elimu sio ya kuacha ikaenda hivi. Kwa lazima tujifunze. Mimi nikapokea hapo. Nilipopokea, baada ya kupokea nikawa mwanachama. Asa nipokuwa tu mwanachama, nipoeleza nyumbani, wakasema hayo mambo mnayojifunza mbona ni mabaya. Lakini nilijaribu kumwambia mama. Nikamwambia mama, faida ni 1, 2, 3. Pamoja na kwamba nilikuwa sijakuwa mwanachama halisi kabisa, ila nikaona faida zipo. Asa baada ya kukaa na mama nikamweleza vizuri, akasema haina shida, wewe endelea.
Ensuring the survival of newborns, selected health facilities were rehabilitated with new gender-responsive maternal wards, theatre rooms with modern equipment, breathing machines, wash facilities and solar energy units. A total of 3 maternity wards and 3 operating theatres were constructed in 3 health centres in 3 districts of Kigoma region. The modern equipment, which includes anesthesia machines, baby warmers, heavy-duty sterilizers, operating beds, and etc., were supplied together with 3 water harvesting tanks of 30,000 liters each health facility and taps, and 12 health facilities were equipped with solar panels. Global Affairs Canada enables SUSTAIN to relocate some of its budget towards COVID-19 response in Kigoma. Planned in partnership with the regional and district medical offices, SUSTAIN provided PPE war supports, gloves, rubber sheets for mothers and babies, and SGBV prevention education materials. This relocation enables SUSTAIN to respond to crucial health needs during the pandemic, while simultaneously protecting and enhancing RM and CAH services in Kigoma. These investments cost $1,650,000. All this was made possible because of the support from the Canadian government through Global Affairs Canada. They are a committed partner to the government of Tanzania and to World Vision.
I am delighted to be able to talk to you about the SUSTAIN project that Canada is so proud to have supported with World Vision and other key partners like Praxis and Sick Kids Hospital from Canada. Canada is deeply committed to improving the health and well-being of women and girls. This is one of Canada's most significant international commitments under our Feminist International Assistance Policy. Canada and World Vision haven't done this work alone. Partners in the government of Tanzania have been key to the project's success. As you have seen, together, we have directly reached more than 319,000 Tanzanians with improved maternal and newborn health services at more than 94 health facilities across Kigoma region. Canada, World Vision, and the government of Tanzania all strongly agree that gender inequality is one of the biggest barriers preventing women and girls from seeking and receiving health services. Because of this, Canada and World Vision prioritize doing gender analysis as the first step in a project. This includes talking to women, girls, families, religious and community leaders, and healthcare workers. World Vision used the findings to design the SUSTAIN project to ensure it responds to women's and girls' priorities and needs. Canada firmly believes this improves projects, and we think SUSTAIN is an excellent example.
The regional authority has expressed their enthusiastic appreciation for the support that they have received in gender-responsive health systems strengthening in the region.
Tunashukuru SUSTAIN pia waliwezesha hilo, wataalamu wetu wa afya kukutana, kuzungumza utekelezaji wa mradi, kutathmini nini wamefanikiwa, lakini pia kuona maeneo ambayo hayakufanikiwa na kujipanga upya kwamba nini watafanya. Sasa hivi vikao vilikuwa vinafanyika kila robo mwaka ili kuweza kufanya hizo tathmini. Vimesaidia kufanya mpaka mradi unaisha kukawa na mafanikio makubwa sana kuliko ambavyo wangekuwa wanafanya afu waje wafanye tathmini baada ya miaka 4 au mwishoni mwa mradi.
As a result, where there was no electricity, there is now. Where there was no operations room, well, there is now. Where children could not breathe, there is a breath now. Healthcare workers are now better, able to handle complicated deliveries, and are thrilled with the enhanced ability to provide high-quality, gender-responsive and respectful care to their patients. These RM and CAH improvements have reached 1,500,000 people indirectly in these districts. The regional government has committed to continue with project activities for sustainable reproductive, maternal, newborn, child and adolescent health services. As SUSTAIN has imparted health facility management teams with skills on safety, newborn care, and gender and adolescent responsive evidence-based planning, budgeting, and decision-making. The SUSTAIN project will continue bringing hope and saving lives of children, adolescents, mothers, and fathers in the region. And the gender equality transformation will have multi-generational impacts in the communities of Kigoma.